Hello and welcome to Health Show with Amara from our London studios. I'm Dr. Amara Sohail. Our today's topic is hypertension or high blood pressure, a silent killer. We are going to unravel the mysteries behind high blood pressure, the risk factors, and more importantly, how to take charge of our lives to prevent the deadly consequences of this condition. To discuss that, we have invited today Dr. Avais Masud, all the way from United States. He is an expert in the management of hypertension in New Jersey, and he has got years of work in this particular field. Let's welcome Dr. Avais Masud. Thank you very much, Dr. Masud, for joining us today. And we know that you are very busy, you're on call, but you spare time, and we are ever so grateful for your contribution to our show. So, as I mentioned, our today's topic is hypertension. Before we discuss the topic, we would like to know about your journey, because we know that you have achieved a very high position in your field in America. We would like our viewers to know about your journey. What were your struggles, challenges, and how did you make it to this position? So please let us know about you.
Thank you, Dr. Amara, for inviting me for this very important discussion and topic. My name is Avais Masud. I'm originally from Pakistan. My medical school, I went to Rawalpindi Medical University. After that, I came to US in '92. And after that, I did my residency in New York. Then after that, I went for my nephrology fellowship to Virginia Commonwealth University in Richmond, Virginia. I picked that particular institute because I had interest in hypertension, which I developed during my residency. And at that university, there was a very high-level, high-profile hypertension specialist. One of them, Dr. Sika, was president of Hypertension Society of America for many years. So after that, I went for University of Massachusetts for my critical care fellowship. And I also went there because there Dr. Irwin was a big name in critical care medicine. I went there for my fellowship. So after completing my 2 fellowship, also I certified in hypertension, which is like a subspecialty. And then I came here at Jersey Shore University Medical Center in 2000. So this is my 25th year at Jersey Shore University Medical Center here in New Jersey. And I have been practicing critical care and nephrology, and I became the medical director of a fellowship here, nephrology fellowship at Jersey Shore University Medical Center, which is a combined nephrology and critical care fellowship. There are many nephrology fellowships here, but there are very few combined nephrology and critical care fellowship. And because of my primary interest and for a long time on hypertension, we opened a hypertension clinic here at Jersey Shore University Medical Center, where patients are referred which are difficult to be controlled. And I also was a member of Council on Hypertension of American Heart Association. So I have been on this field for almost 25 years.
That's awesome. And listening to your profile, we feel very privileged and honored that you are going to tell our viewers about what hypertension means. So if you could start with what is hypertension or raised blood pressure, please?
Hypertension actually is the condition when people have high blood pressure, is the most common condition all over the world for which patient needs medication. So this is the one. And also, because of that, it can lead to many complications. Also, we're going to talk a little more detail later. That's why the blood pressure has to be controlled and managed.
So before we talk about the complications, Dr. Masud, tell our viewers, what does a normal blood pressure mean?
Okay. There's a little bit, not controversy, but definition is a bit different in US and in Europe. So I'll go by European definition. So basically, there are 2 types of blood pressure. One is a higher number, one a lower number. The higher number are systolic blood pressure. When the heart contracts and it generates some blood pressure, and that is called systolic blood pressure. That's the higher number. When the heart relaxes and that is a lower number that's called diastolic blood pressure. So as per European guideline, the blood pressure means when your blood pressure is more than 140, the higher number, or the lower number like diastolic blood pressure more than 90. US definition is a little bit different, which is like a 130 over 80.
So, what are the main reasons why do some people develop high blood pressure? Are there any risk factors, or some people are more vulnerable to having this problem?
Yes, most important thing is genetics. So if you have a family history of hypertension, you have more risk to develop hypertension. So you should be more careful to avoid it. Okay, that's one thing. The other thing that there are many other conditions which can lead to high blood pressure. Most important, obesity, which is like a rising all over the world. So obesity is a like high risk for high blood pressure. At the same time, if you have chronic kidney condition, or you have a other than that, like if your habit is sedentary habit, you are not physically active, that can lead to high blood pressure, particularly if you have a family history. Also, people who have diabetes, they can have more risk to develop diabetes. So these are main factors, like your family history, your lack of physical activity, and you're gaining weight, and the food you eat. Like if you're not careful watching your food, that can lead to hypertension if you have risk factor of hypertension.
So, how do people actually know whether their blood pressure is high or not? Because normally, especially like in the day-to-day life, we don't keep a check on our blood pressure. And are there any symptoms that we should be looking for?
I mean, that's the important thing, because in the beginning, until you have very high blood pressure, like a very high level, or only then you develop symptoms like a higher number of 180 or high. Below that, you don't get any symptoms. That's the bad part, a good part, but that's the reality, and that's why the hypertension is labeled as a silent killer, because people carry hypertension, they don't know unless they get checked. So basically, like a 50% patient all over the world who have high blood pressure, they don't know they have blood pressure. They don't get it checked. So how you know that you have high blood pressure? So if you have high risk for hypertension, okay, like you have family history of hypertension, you are overweight, you have diabetes or any other condition, or you think that you are not physically active, you get your blood pressure checked or check your blood pressure, and then obviously you would know. So it's very important that you will not get any symptoms. There are no red flag. You come, oh, this is hypertension. When you have very high blood pressure, then you get headache, nausea, not feeling well, but you don't want to reach to that stage before you know you have high blood pressure.
I mean, as we know that this is a very serious condition, and like you mentioned, that not always people present with symptoms unless it is very high. So what can the high blood pressure do to the body? What are the complications if somebody is unknowingly having high blood pressure? What can happen?
I mean, there's a good news and bad news. Good news is that if you are careful, you take care of yourself, you control blood pressure, even you have high blood pressure, you can avoid those complications, not easily, but can be managed, okay, in even the long term. But if you are not careful with your blood pressure, you're not compliant to medication or doctor advice, it can lead to many complications. The most important ones are like heart disease, congestive heart failure, stroke, kidney disease, and many other conditions that lead to with gradual period of time. So if you are good, compliant with your medication and your diet and physical activity, it's very easy to control and avoid those complications even after 10 years or 15 years or the rest of your life. But otherwise, there are many complications waiting for you to happen.
So it can affect every part of the body, literally, all systems,
Yes,
whether it's kidneys, liver, or heart.
yes, yeah, particularly heart, brain, kidneys, and your eyesight. It can affect many organs.
Okay. And in your practice, Dr. Masud, do you see that people, a lot of patients, they present with strokes or hemorrhage when they are not even aware that they've got a problem, underlying problem?
I mean, I go to educate people at physician level and also like a community level. So it depends on which community you're talking about. I mean, here in US and also in the developed countries, there are people who don't care about the blood pressure. They're not well educated and they end up in hospital with a stroke and found to have a heart disease, found to have complication from hypertension. Yes, but the prevalence is less. But when I go to Pakistan, where is the awareness is less, it's very common. I always see that that person had stroke or heart disease, heart condition, MI or heart attack, and they check a blood pressure. Never had checked before. Blood pressure was 180 or 200, even more than that. So there are many patients who had or have high blood pressure, but they are not aware of that. They were not comparing. Sometimes they have symptoms, but they just ignore it. So yeah, it's not uncommon even in developed countries.
Okay. And are you, I mean, you mentioned obesity is one of the factors. So, and we know that obesity has become a disease all over the world. Do you see that how obesity is rising? Likewise, the blood pressure problems are also on the rise?
It is, particularly in the developing countries, in Africa and in South Asia, which we feel most of the community is in Pakistan, India. The reason being that now people are not that physically active as used to be like a generation or two generations ago. So obesity is rising and the prevalence of high blood pressure is also rising. So two regions, if you go all over the world where the blood pressure prevalence is rising is in Africa and Southeast Asia. So yes, the obesity definitely increased the prevalence of high blood pressure.
And is it a myth or a fact that men are more vulnerable to developing high blood pressure problems?
Yeah, it's a myth. It's not correct. Actually, the same thing, women and also actually, I was reading the prevalence. I mean, in Africa, particularly in Nigeria, actually, there women are more prevalence to have high blood pressure. In all over the world, basically, for some reason, after menopause, even more women has high blood pressure than men. When the younger age, yes, to some extent, slightly lower prevalence in women as compared to men. But after menopause, actually prevalence is equal or even slightly higher in women. They have high risk for to develop high blood pressure.
And what about younger people? Is it a risk in them also?
Yes, actually, I'm not a pediatric hypertension specialist or nephrologist, but I see sometimes very young patients also come, and I actually sometimes have to refer to a pediatric hypertension specialist as young as 14 or 15-year-old. I mean, if they have obesity, I've seen many overweight or obese young adults or actually teenager, they have pressure. And there's no other reason just because they have very overweight, they can develop, particularly if they have family history of high blood pressure.
Okay. And the trend, clearly you mentioned that in women after menopause, the risk of blood pressure problems is higher. So there is age-related trend that as we get older, the risk is higher. What is the reason for that?
I mean, first of all, this is basically like a aging with your risk in not only women but in also risk in men also with aging, and with the some are hormonal changes that happens with women. There are some protective in the early age which are not there at the later age. So that why there's a high risk in women after menopause. They develop high blood pressure.
Okay. And do you think that this condition can be cured?
Yeah, many people ask this question. So the answer is a bit long. Let me just be short. There are two type of high blood pressure. One is the primary hypertension. That means you have like a family history or other reason, and there's no other medical condition which causing high blood pressure. So that primary hypertension, which 90% people have essential of primary hypertension, that condition in majority, vast majority of the condition, it cannot be cured and basically it can be controlled. Okay, some people who develop high blood pressure because they are overweight and they were not careful about their diet, They control, and I have seen some younger people, they were obese, they were not taking care of their diet, and they came to me with high blood pressure. They got motivated, they took care, they reduced their weight, they were watching their food, and they actually were off blood pressure medications. So it can happen. But majority of the essential or primary hypertension, it cannot be cured, but it can be managed.
Okay.
Then comes secondary hypertension.
Yeah.
So that other condition, like some kidney condition, some hormonal condition, that can cause high blood pressure. And many times, if you take care of those conditions, it can be cured.
So you mentioned that lifestyle adjustments, especially losing weight and diet, they can play a major role. But what about the medication? Is it safe to be treated with medication? Because of course, when we take medicine, we have to be careful about the side effects of them as well. So do you know roughly the number of people who need treating with medicines?
Yes, in in US, with the new definition of high blood pressure, about 50% people have high blood pressure out of all. In European guidelines, slightly less than that, but a big majority. And majority of those patients, or at least half of those patients, they are not on blood pressure medications. Uh, so almost all the patient depends upon their level. If they're like from European guideline, if their higher numbers are more than 140 and the lower number diastole is more than 90, they need medications. But the good news is that there has been great progress over the last 20 or 30 years regarding blood pressure medications. Safer and safer medication are coming, and they are like easy to take, like once a day. And blood pressure medications are very low side effects causing medication, depends upon which medication you're taking. And now there is no blood pressure, I can say that, with very few exceptions, which cannot be controlled.
Okay. And are there any medicines that are relatively safer to take? Like, for example, I don't want to talk about the technicalities, but um, in US and UK, I'm sure the treatments would be the same. So what kind of medication do you normally recommend as the first line in US?
Yeah, there are three or actually four class of medication which is first line therapy. The most common all over the world called calcium channel blocker, like amlodipine and nifedipine. They are most common blood pressure medication prescribed all over the world. They are cheaper, they are very easy to take, like once a day, and they're long acting, and also very few side effects. Other than some people some swelling of the ankle and leg, that is the way medication works, but it's a very, very safe medication. Virtually no other side effects other than some edema. So that is one. Then the other medication, we call it angiotensin converting enzyme inhibitor, ACE inhibitors, or ARBs. Those medications also very safe, very effective. There are some side effect to some people. If you have kidney disease or some other condition, then you have to be careful. But otherwise, generally very safe. Again, once a day. And the third medication are called thiazide diuretics. They are water pill. Those are very effective, very cheap medication for blood pressure. But there are some side effects can happen with those medications like low potassium, low sodium, so that need to be monitored. Generally, they're all three medication or four medications. They're very safe, low level of side effect, but can happen. In the European guideline, there's other type of medication called beta blocker. They're also now included as first-line therapy, while in US, we don't consider those medications as the first-line therapy, second-line therapy. So calcium channel blocker, ACE inhibitor, ARBs like valsartan or losartan or thiazide diuretics, and beta blocker like metoprolol. Those are first-line therapy medication in according to European guideline, which people follow in England.
So when you start the treatment, you'll start with the ones that have got lesser side effects, and then when do you decide that this is not effective? Is there a time scale you give them to see whether the blood pressure responds in a positive manner?
Yeah, it depends on the level of blood pressure. If somebody has called stage one hypertension, like blood pressure is not too bad, it's okay to start with just one medication only. If at presentation blood pressure is high, like 160, 170, so we always start with two medication combinations same time. Luckily, we have a combination of medication available all over the world, and one pill contains two medications. So the compliance is increased from that. And very commonly, majority of the patient which I see, I start with two medications from the start. Okay, actually, combination also decrease the complication level from the medications, like swelling of the one medication like amlodipine is less likely to happen if you combine with ACE inhibitor. So it depends upon, like, for mildly high blood pressure, one medication enough. If more than that, then two medications. Sometimes in the beginning you need to start three medications.
Yeah. Because general concept amongst patients is that the more medicines they take, the risk of side effects goes up, but that's not true, because you are saying that it is much better to have a combination, especially if the blood pressure is not controlled, because the side effects will be less if they are given combined therapy. Because
Actually, the consequences of not having controlled blood pressure is far more than the side effects. Okay, side effects are much lower nowadays. These medications are very safe nowadays, luckily, as compared to, I know that like 20, 30 years ago, there was a medication which had a lot of side effects like clonidine and hydralazine, and like other medication had a lot of side effects, orthostatic hypotension. But now these medications are very safe.
okay. And what should the patients aim for? What is a normal blood pressure to those who have been treated with medicines?
Yes. So it's guidelines, like I'll stay with the European guideline because in England people follow that. In US it's very simple. Any person from any condition, when you start blood pressure, your goal should be systolic blood pressure, high number should be less than 130. In European guidelines, a little bit difference. They depends on like less than 140 or something less than 130. But also these are guidelines. As a physician, you have to individualize the patient. Some patients who are elderly, who are cannot tolerate too aggressive blood pressure lowering. So you have to individualize the patient. So what blood pressure they can sustain without having symptom like dizziness, or they have a difficulty in keeping their balance. That is important things. So because in elderly patient, the very high risk is for fall, because an elderly 75 or 80-year-old person, if she or he falls down, break a leg, something like that, that could be fatal. So you have to make sure that person is can tolerate that level of blood pressure. But as generally, when we start medication, the aim is to keep the higher number systolic blood pressure less than 130.
Right. So, of course, like what you've just said is that low blood pressure, of course, there are consequences if it drops too much, and then patients, they have to be aware of the risks of falling and feeling unwell or dizzy. So, these are the things they should be looking for. And so, home monitoring, how do you recommend home monitoring to people when you see them in the clinics?
To everyone, patients should have, like patients who have diabetes, they check your blood sugar at home. So similarly, patients who have high blood pressure, they should check their blood pressure at home, but not as frequently. Diabetic patients, they have to check many times a day their blood sugar, but hypertension patients, they don't have to. They can do like once a day is okay, or even 2 or 3 times a week is okay if the blood pressure is stable and well maintained. But we advise all the patients who are on hypertension medication to check their blood pressure at home.
Right. And with the complications that you have mentioned, I remember there are some patients who have been very apprehensive about major risks. For example, there are some blood pressure medication that can cause erectile dysfunction in men. Is that true?
This is very true. Basically, it's not all, I'll tell you that couple of medication do not cause that. Majority of the blood pressure medication, they do call ED. Okay, some more, some less. We call it doxorubicin, like alpha blockers or beta blockers, they cause more ED problem. But there are two classes of medication that do not cause that. One of them is ACE inhibitor, like lisinopril or ramipril medication, or losartan or valsartan. Those medications do not cause ED. At the same time, one new beta blocker is called bihistoric or benavipril. these medications do not cause ED. So basically, if you have ED issue or you ask your doctor, talk to your doctor most likely will prescribe you like losartan, valsartan, or ramipril, those kind of medication, or benavril. Benavril, some new medication came in. These are, but in common medication like amlodipine cause a little bit less. If you are other medication like verapamil or cardizem, those should not be given for blood pressure anyway. These are not blood pressure medication. These are uh, for AFib or other heart condition. Yeah, it's a major problem which can be managed with adjustment of medications.
Okay. So this should, and again, like you said earlier on, that it's mainly medication will only be given to reduce the risks, and it is very important that blood pressure should be controlled, because of course ED can be a concern for men, but having good health and not complications in other parts of the body is also very important. And I won't expect that you will give those medicines that have got major side effects as the first line therapy anyways.
Not at all. So, like I told you, that alpha blocker, we call it, like a doxazosine, although these are actually fourth tier medication. They are not first tier medication. First line therapy medication or a first line therapy medication, hydrochlorothiazide causes EDs to some extent. Beta blocker are cause more ED, but those are not first line therapy in US. In UK, those are now first line therapy, but if somebody has ED issue, that should not be on beta blocker if possible.
Yeah. And again, while we are talking about the medical treatments, are there any medicines for other health conditions that can also cause blood pressure problems?
This is a very important question, and people should be aware of that. Okay, like there are other medication which can increase your blood pressure, or you taking blood pressure medication. The most common are like some decongestion medication. When you take, you have a flu or you have congestion, you take some over the counter like a decongestion medication. This can increase your blood pressure. So be careful about at that time, or talk to your doctor, or you have to raise your blood pressure medication dose. Some psych medication, those are also very commonly increase your blood pressure. These are two classes of medication which can increase your blood pressure. So you have to be careful and make sure that you talk to your doctor when you're taking this medication and if your blood pressure is not controlled.
Right.
And
And
also,
yeah.
one of the most important one is that when you take some pain medication, we call it like a non-steroidal anti-inflammatory medication like Advil, ibuprofen. These are very commonly, they can increase your blood pressure. So basically, they're the antidote for your blood pressure medications. So if you have to take some Advil, ibuprofen for your pain or something like that, make sure that you contact your doctor and he or she knows about those medications.
So, I mean, you mentioned NSAIDs, which like in UK, naproxen or ibuprofen, these are the medication that people use without worrying too much about it for any kind of pain. So, you're saying that people have to be very careful when they are overusing these medicines for pain. Because
particularly if you're taking that medication, losartan, valsartan, or ramipril, or lisinopril, like ACE inhibitor or ARBs, and if you take NSAID with that, actually these are very bad combination, not just for blood pressure, but also kidney, because they can decrease in some patients who are prone to develop that, can decrease your perfusion or blood flow to your kidney and can cause some kidney injury also at the same time. So if you're taking losartan, valsartan, it's better even more careful taking this medication NSAID, like ibuprofen and all those medications.
right. And just out of curiosity, in the United States, do you have a healthcare where people with vulnerabilities or risk factors, they are kept under surveillance to monitor their blood pressure, or they are expected to do home monitoring?
I mean, some patient will do like a 24-hour monitoring also, because sometimes people, they have very labile blood pressure. Sometimes they come to office, their blood pressure is high. At home, their blood pressure is low. This commonly happens. We just ask them to check their blood pressure more frequently. But sometimes the other way happens. The blood pressure is like high at home and blood pressure is low at office. And there are few patients, some rare patients, they need a 24-hour ambulatory monitoring of blood pressure. We attached device with them, and that take the blood pressure every 15 minutes in daytime and every half an hour in night time, and we get the idea that how is the overall blood pressure control is. But most of the patients don't require, but some patients do require, and we do them.
So, is this the term, the white coat hypertension, still applicable? Because some patients, they are in denial, because when they come to hospital and their blood pressure is high, they say, oh, it's only when they come to the hospital. Normally at home, it's never been the case. Do you come across that?
All the time. It's all the time. I mean, but and it's a reality, there is a such thing as white coat hypertension. People come to office, they're very, anxious, the blood pressure goes high, but not everybody. Some people, even they are anxious, the blood pressure doesn't go beyond certain range. So if blood pressure too high in when you're anxious, that is not like a normal condition. That also increase your risk for long-term consequences from high blood pressure. So those are the patients who like to check the blood pressure at home multiple times a day for like at least a week. So when they bring to doctor's office, we have some idea that how his blood pressure stays at home most of the time. And sometimes we have to put them on 24-hour blood pressure monitoring. So we have to care. We cannot take this lightly that, oh, this is just a white coat hypertension. That's why the ideal way to check blood pressure is that when person comes to office, put her or him to a separate room, and that digital blood pressure monitoring when that person is by himself or herself, and wait for 5 minutes just to reduce that anxiety of somebody watching while blood pressure is being taken. So whatever you can do to reduce the anxiety at that level. But this is a important factor, and this is not a normal to have very high white coat hypertension.
Yeah. And now, since we are living in the world of artificial intelligence, and there is so much progress in the field of medicine, more in United States, I think. I mean, I was reading about this kidney Intellex, something which is FDA approved, and it is used to screen people regarding their risk of developing blood pressure at any stage in life. Is that used in US?
No, not commonly, but will be used soon, and this is actually helpful. Okay, it put all the data together. What are the risk factor and what are your risks to develop? Actually, this is a good development, and I think it will be used in my office or in our clinic. We don't use that, but I know there are some program available, and if it is more commonly used, it just will increase the awareness. People should be careful. So if you are careful about your risk, if you have like in a family, if two people and they have same inheritance, both have risk factor to develop high blood pressure. One person knows already that he or she has this factor and take care of himself or herself, and chances that that person will be much better off either avoiding developing hypertension or much better control as compared to other person. So education is the key.
Yeah. And so you think that artificial intelligence is going to revolutionize how we manage and treat the hypertension, you think?
Yeah, absolutely.
Okay.
Absolutely.
So,
yes.
like Dr. Masud, you mentioned earlier on about the lifestyle adjustment. So, could you kindly, would you tell our viewers give them an advice of how they should live their life in terms of the diet, exercise, a general advice to everyone? Because again, no matter how much we are advancing in medical sciences and all that, but back to basics is what we are witnessing again. Artificial intelligence is one thing, but basic lifestyle adjustments is a key. So would you kindly give advice regarding the diet, the exercise, what kind of exercise, etc., please?
Yes, actually, this is my favorite topic to talk about too, because it's let me tell you that medications are like only 1/3 of the treatment of blood pressure or management, or maybe a little bit more. But most important is lifestyle adjustment, the diet and the exercise. So let's start with the exercise first. So some people say, "Oh, I cannot do that much exercise." Okay, it's even you do very little physical activity, like a 5 minute. that is better than nothing. But ideally, to control or better manage your blood pressure, a person should do 150 minutes per week, like a moderate exercise. Okay, moderate exercise example mean like brisk walking or cycling in a plain, road, that kind of activity. So that's moderate. 150, like about 30 minutes, 5 times a week. These are okay. Or strenuous exercise. Okay, less than that, you can do that. So that is required. But if you do less than that, like you just like 10 minutes walk every day, that is also helpful. Studies have shown that people who do some activity, even that activities also control the blood pressure. Obviously, if you do more, the benefit will be more. So physical activity is very important. Secondly, diet. Again, diet, not very complicated. First thing everybody knows that the sodium or salt is the enemy of the high blood pressure. So you need to reduce your salt intake. Okay, people say, "Oh, I don't put salt on that." But again, you have to watch every time you go to grocery store. You see what you are eating. You look at the sodium contents of that. So if you keep the salt like less than 5 grams a day, that is required. That's the most important. So uh, then they call it DASH diet. Okay, call it dietary approach to reduce or control hypertension. That was suggested about 3 decades ago. That means that includes low salt diet and also diet which have high potassium like bananas and other, because high potassium, unless you have kidney disease, high potassium and low salt, low sodium, these are better for blood pressure. And then you reduce your fatty food, uh, okay, reduce that. And also obviously like very sweety food, avoid that to control your weight gain. So diet is very important, and exercise. The good thing is that about the exercise, you don't have to be like run marathon for that. You just can do some activities, gradually you increase, and that will be helpful to control the blood pressure.
Yeah,
Obviously, the
that
other
is.
thing like yeah, smoking, and smoking is important. If I mean, avoidance of smoking, you should quit smoking if you smoke. And alcohol intake also is increased blood pressure. You have to reduce your alcohol intake to control your blood pressure. These are major recommendations other than medications.
That's fantastic. So it was a very insightful and a very comprehensive discussion today, and you have covered this very important topic so beautifully. I'm sure our viewers would benefit from it, and I hope they take your final message of lifestyle adjustment. So thank you very much, Dr. Masud, for your time. And we were fortunate that even though you were on call, you did not get a call during this conversation. So thank you very much once again. We would like to invite you for more sessions to discuss other medical problems very soon. Thank you once again.
Thank you so much. I'm lucky that I didn't get a call, but I'm glad that I told my resident fellows not to disturb me during this hour, because this is my favorite topic to talk about, because obviously more awareness we spread to the patient is good for them. And the good news again is that there's no blood pressure which cannot be controlled with medication. And all the patient with blood pressure don't have to again run a marathon or something. Little activity is helpful. More they do is better, and it's very easy to control dietary restriction also without affecting too much the dietary habits. But awareness is the most important. Thank you very much for to
Thank
invite.
you. Before I let you go, since you mentioned your role as a director of fellowship program, for our viewers, would you kindly tell how easy or how difficult it is to get into the fellowship program in the United States? Because a lot of our viewers would want to know that.
I mean, I tell the resident actually there's nothing difficult if you are single-minded and you put your effort. One advice I give to all the young physicians that never underestimate your potential. Okay, and if you aim for something, go for it. There is no reason you cannot do that. Okay, so yeah, it's not easy. Nothing is easy in this world, but I don't think that is impossible to get into it. You also have to make efforts. Some are specialties that are more competitive than compared to other, but I have seen people getting almost all of them who are single-handed, and they put their effort to that. So yeah, I mean, it's not easy, but if somebody interested to come into US, going to training here, they should put effort, and there is no reason he or she cannot do it.
So that's awesome. So aim high and work hard, and you will get to the position Dr. Masud has
Never
achieved.
underestimate your potential. I've seen some very brilliant. They say, "Oh, I cannot go to this specialty because too tough, and I cannot." I said, "No, you can, but you don't have to have that kind of mentality. Oh, it's too difficult. No, nothing is difficult."
Of course, where there is a will, there is a way. So thank you ever so much once again, and we look forward to seeing you again soon.
Thank you so much. I was glad to be here. Thank you.
So viewers, I hope that you have benefited from this very insightful session on hypertension, and you've got a clear message that lifestyle adjustments not only prevent this condition but also can cure it as well. So goodbye for now. We'll be back with another topic next time.